Reduction in late mortality among 5-year survivors of childhood cancer. Definition. Due to the current therapies such as chemotherapy, combined surgery, or radiation therapy, it is expected that the majority of children with cancer reach adulthood.
If you or someone close to you has been recently diagnosed with cancer, you know how overwhelming it can feel. Maybe you're also getting tons of confusing information and advice. Let's cut through the noise, discover what cancer really is, and learn about available treatment options. After all, the more you know, the more confident you'll feel when talking to your doctor and making decisions. So, what is cancer? The answer begins in our cells. Our bodies are made up of trillions of them, and they're constantly dying and regenerating. Normally, a cell divides and makes a perfect copy of itself using a genetic blueprint called DNA. That copy also divides, and so on, while older or damaged cells are told to die off, making way for new, healthy ones. Once in a while, though, the DNA blueprint in a cell can get damaged. Sometimes the cause is a chemical or environmental carcinogen. You might even have a hereditary risk for cancer. Other times, we don't know the cause. Normal, healthy cells are highly regulated by your body and listen to signals for when to grow, divide, and die. Sometimes, the cell's blueprint is damaged in such a way that it stops listening to the body and ignores the body's signals. And so, this rogue cell keeps right on dividing, and dividing, eventually forming a tumor. In some cases, the cancer stays put and is localized. In other cases, the cancer spreads or metastasizes. When they are metastatic, tumors consume the body's resources as they grow, destroying healthy, functioning tissues and organs along the way. So what's next? Well, one way to start dealing with cancer is to arm yourself with information about your options. If caught early, many tumors can be removed with surgery. Radiation is another kind of treatment. It attempts to kill cancer cells by aiming small doses of radiation at very precise areas. But at times, cancer spreads to distant tissues. In this case, doctors may use chemotherapy, or chemo, to attack rapidly dividing cancer cells. Unfortunately, this treatment also attacks other types of cells that divide rapidly, such as the ones that make up hair and skin cells. There's also a promising new kind of treatment called targeted therapy, which uses drugs that are precisely, targeted at the underlying DNA mutations causing your tumor to grow. And this can be more effective and less toxic than traditional treatments. To see if targeted therapy is an option for you, there are tests that identify the changes in your DNA that are unique to your tumor, so treatment can be tailored just for you. Then, specialized drugs may be used to attack the cancer cells, with fewer effects on your healthy cells. So, there you have it, the basics of cancer and common treatment options. Now, you're better prepared to talk to your doctor about what's available for you.
Application in medicine. The work has analyzed the use of chemotherapy after the removal of cancer and compared it with patients who only undergo surgery. It concludes that the complementary treatment demonstrates an effectiveness.
According to the World Health Organization, cancer cases are expected to rise a whopping 57% worldwide in the next 20 years. You probably know or are related to someone who has fought cancer, and you may have seen them go through chemotherapy. But what is it? Hey guys, Julia here for D News. Currently, a diagnosis of cancer leaves patients with three main options for treatment: surgery, radiation, and/or chemotherapy. Of the three, chemotherapy can be the most debilitating. It's a pretty barbaric treatment. Technically, chemotherapy is a poison, but it's a poison that ultimately saves lives. The original chemotherapy drug was a derivative of mustard gas. During World War II, scientists noticed poison gas exposure shrunk the lymph nodes, and along with it, shrunk lymphoma, a malignant tumorous growth of the lymph nodes. Even though it's a poison, it proved extremely successful in treating cancers throughout the mid-20th century. Today, chemotherapy is used to dramatically improve survival rates for breast cancer, and it's the primary form of treatment for cancers of the blood, and has great success in the early stages of Hodgkin's lymphoma. It's often used before or after other treatments for other types of cancers. For example, when cancerous cells are left behind after surgery or radiation, adjuvant chemotherapy is used, whereas neoadjuvant chemotherapy is used to shrink a tumor before a surgery. Chemotherapy works by targeting cells that divide rapidly, one of the hallmarks of malignant tumors and other cancers. Like the chemotherapy drug etoposide is used frequently to treat diseases like lung cancer, Ewing sarcoma, and lymphoma. According to a study published in the journal Chemistry and Biology, the drug attacks the topoisomerase II enzyme, which cancer and other rapidly dividing cells depend on to unwind DNA. By inhibiting this enzyme, the cell can't make DNA as well, and thus the cell gets programmed for death, which in medical speak is called apoptosis. But unfortunately, these kind of drugs don't target just cancer cells. They affect other rapidly dividing cells in the body as well, like hair follicles, which is why chemo patients often lose their hair. Other common side effects I'm sure you've heard of include nausea and fatigue. As common as nausea is, it affects people differently, perhaps because of their expectations. A study published in the journal Cancer found that patients who think nausea is a very likely side effect experience it 5 times more often than those who think it's less likely. According to the National Cancer Institute, up to 96% of chemotherapy patients experience fatigue. People describe it as feeling jet-lagged all the time. Chemotherapy makes people tired because it changes the endocrine system, circadian rhythms, metabolism, and serotonin production. There is some evidence, though, that antidepressants and weirdly exercise helps fight fatigue. Chemotherapy can also cause diarrhea, hearing loss, and even decrease sex drive. But will we one day treat cancer without it? Well, new treatments are starting to pave the way. One study published in the New England Journal of Medicine found that molecularly targeted drugs work almost as well as chemotherapy without many of the negative side effects. Rather than suppressing all fast-growing cells, targeted therapy works by honing in on specific mechanism cancer cells use to grow. Basically, it's like hitting the bullseye rather than spraying the wall full of bullets. As Dr. George Dimitri at the Dana-Farber Cancer Institute told Time, the future lies with personalized medicine, where therapies are targeted towards an individual's cancer. When planning a strategy to fight against a cancerous tumor, it's helpful to know what a tumor is. I explain more in this episode right here. Many tumors come from an overgrowth of tissues, maybe caused by a mistake in DNA. DNA might be damaged from radiation, tobacco smoke, or other environmental agents, or maybe it's just a stroke of bad luck. Whatever causes it, this mutation makes the cell divide uncontrollably. Alright guys, so do you have any other questions about medicine? Let us know down in the comments below. Don't forget to hit those like and subscribe buttons, and keep coming back here so you don't miss a single episode.
Pros. Chemotherapy may shrink your cancer or slow down its growth, which can help you live longer and feel better. After surgery, chemotherapy may reduce the chances of the cancer coming back. You may have more regular check-ups, tests, and contact with your medical team. Some people find this reassuring. For a small number of people with borderline resectable cancer, chemotherapy may shrink the cancer enough to make surgery to remove the cancer an option. Cons. Chemotherapy can cause side effects. You will need to go to the hospital often for treatment, which can be tiring. It affects everyone differently and may not work so well for everyone.
Childhood cancer facts. These are the facts. Each school day, 46 children are diagnosed with cancer. 1 in 330 children will develop cancer by age 20. Each year in the U.S., over 12,600 children are diagnosed with cancer. Although the 5-year survival rate is steadily increasing, 1/4 of children diagnosed with cancer will die 5 years from the time of diagnosis. 80% of children have metastatic disease at time of diagnosis, as compared to only 20% of adults. Cancer remains the #1 disease killer of America's children. Depending on the type of cancer, if detected early, it drastically improves the chances of survival. While the world continues to search for the cure, early detection offers a glimmer of hope to what is a very unforgiving, uncertain, and scary disease. The question is, would you want to know early if your child has cancer? Now you can. Find hope through knowledge at www.reddrop.com.
Cancer is one of the leading causes of death worldwide, responsible for about 8.8 million deaths in 2015. Treatment options for cancer include chemotherapy, radiation therapy, and surgery. Chemotherapy destroys cancer cells by targeting rapidly dividing cells. But during the process, normal cells are also most likely to be damaged, which include blood-forming cells in the bone marrow, hair follicles, and cells in the mouth, digestive tract, and reproductive system. Certain chemo drugs can also damage cells in the heart, kidneys, bladder, lungs, and nervous system. Let's see some of the common side effects of chemotherapy. Number 1. Fatigue. During chemotherapy treatment, most patients might experience fatigue and general weakness. The persistent exhaustion and weakness can make it hard to do everyday activities. In some patients, chemotherapy can lead to anemia and low red blood cell counts, which can worsen the fatigue. Number 2. Nausea and vomiting. Another common side effect of chemotherapy is nausea and vomiting. This mainly occurs as a result of the damage to healthy cells in the stomach and intestinal lining. Anti-nausea medications are given along with chemotherapy drugs to help alleviate this symptom. Number 3. Hair loss. Chemo treatments can also lead to hair loss. You will start to notice hair loss generally about 1 to 3 weeks after the initial treatment. Losing hair, especially for women, can be a depressing situation. Not just the hairs on the head, chemotherapy can affect eyelashes, eyebrows, armpit hair, and pubic hair. Number 4. Diarrhea. During chemotherapy, the lining of your stomach and intestines become damaged, which cause diarrhea. Patients may experience loose watery stools several times a day. It could also be accompanied by nausea, bloating, and cramps. In addition, diarrhea may be a consequence of biochemical changes caused by chemotherapy. Number 5. Mouth sores. Chemotherapy can cause sores inside the mouth, and on the mucous lining of the throat and digestive tract. These sores are known as mucositis, which can cause pain and infections, and also makes it difficult to eat, drink, and swallow. So, these are some of the common side effects of chemotherapy. Always tell your doctor and oncology nurse about any side effects that you may be experiencing due to chemotherapy. Please share the video with your friends and family, so they can also benefit from the information. If you find it helpful, give a thumbs up, and comment your suggestions below. Don't forget to subscribe, to stay healthy with upcoming videos from Health Veins.
Issue applied in medicine. Statistics show that each year more than 116,000 children throughout the world are diagnosed with cancer. This disease is the second most frequent cause to infant mortality in children 1 to 14 years.
Did You Know video series, Cancer Statistics by the National Cancer Institute. Did you know cancer statistics guide researchers towards new ways of preventing, diagnosing, and treating cancer? Statistics is the science of collecting a large amount of numbers or data and using them to tell a story. At the National Cancer Institute, the Surveillance, Epidemiology, and End Results, or SEER program, uses statistics to tell us what is happening with cancer in the United States. Let's take a look at some of the statistics on a SEER stat fact sheet. 5-year relative survival is the percentage of patients who have not died from their cancer 5 years or more after being diagnosed. If the percent surviving 5 years is 66, this means that out of every 100 people who were diagnosed with this cancer, 66 have not died from their cancer in the 5 years since diagnosis. You can also see how many people were diagnosed in a specific year as the total number of new cases or as the number of new cancer cases per 100,000 people. The number of new cases per 100,000 people is called an incidence rate. Looking at the number of new cases per 100,000 people allows researchers to compare cancer rates over different years, even as the U.S. population changes. What if you want to know how many people are currently living with cancer in the U.S.? For this, we use a statistic called prevalence. Prevalence is slightly different from incidence because it measures both new and old cases rather than just the new cases. Prevalence combines both measures of the incidence and the likelihood of surviving cancer. This is especially important for planning the amount of health services that will be needed to care for cancer patients. The number of people who die from cancer in a year can be shown as the total number of deaths, or as the number of deaths due to cancer per 100,000 people. The number of deaths due to cancer is called a mortality rate. Data from new cases and deaths can also be looked at by age, race, or ethnicity, and male or female. This helps researchers figure out who might be at higher risk or who should be screened for a particular type of cancer. Because surveillance statistics are based on large groups of people, they cannot be used to predict exactly what will happen in an individual patient. However, gathering these data over time can show trends in new cases, deaths, and survival. This shows where more research is needed. You may be wondering where all of the data come from. Local hospitals and clinics report the data to cancer registries, which then gather the information and send it to SEER. SEER combines the data to calculate cancer statistics that represent the U.S. population. SEER has many resources to help you find and understand cancer statistics. NCI map stories show cancer-related data through the use of U.S. maps. To see the maps, visit gis.cancer.gov/mapstory. Printable stat fact sheets summarize the latest cancer statistics for common cancer types and link to more information about risk factors, treatment, and clinical trials. The annual report to the nation provides an update on cancer statistics in the United States. For more information on statistics and additional resources, visit seer.cancer.gov.
Conclusion. With advances in therapeutic strategies, each time more children and adolescents survive cancer. However, it is crucial to assess the late effects of neoplasm and its treatment and adapt the future therapies.
Cancer is the name given to a whole range of diseases caused by uncontrolled cell growth in the human body. Cancer can affect anyone, because we are all made up of cells. Trillions of them working together. When these cells become old or damaged, they stop growing or are destroyed. New cells then reproduce to replace them. Normally, this destruction and growth of cells is kept in balance. But, very rarely, the controls that stop individual cells from reproducing fail. A damaged cell, instead of being destroyed, may start to divide uncontrollably, forming a lump or tumour in the human tissue or organs. If these cells are able to continue spreading, the tumour is known as a cancer. It can grow unnoticed or begin to affect the normal workings of the body. Some cancerous cells can break away, travelling through the blood or lymphatic system and causing secondary cancers in other parts of the body. However, not all cancers form tumours. When blood cells grow uncontrollably, they spread gradually in the blood as a leukemia. And with so many different cell types in the body, many forms of cancer can develop. Cancer is not a modern problem. A tumour was described in a medical textbook from ancient Egypt. And Hippocrates, the father of medicine, seeing blood vessels stretched around a tumour, first named the disease using the Greek word for crab. Over the centuries, we have certainly become more aware of cancer, but at the same time unlocked many of its mysteries. Crucially, scientists have discovered that cells turn cancerous only when the genes inside them are damaged. The longer you live, the more damage can occur. So, as life expectancy rises around the world, cancer is becoming more common. We now know that external agents, such as tobacco and radiation, an unhealthy diet and lack of physical exercise, can all increase the chance of genes being damaged, and that in some cases a risk of cancer can be inherited. Today, medical advances also mean that treatment is possible following a diagnosis of cancer. The most common form, surgery, can remove some kinds of tumours from the body. Radiotherapy may be used to damage or destroy cancerous cells, while anti-cancer drugs, employed in chemotherapy, can kill cells that are dividing rapidly. And scientists are now beginning to develop drugs that can target the disease at the level of individual molecules. A single cure for cancer is unlikely because of the many forms it can take. As a species, we must continue to live with cancer, but with greater hope of controlling it.